Hello, I'm Leanne Sherrod. I'm a speech-language pathologist and the President and Chief Clinical Officer here at Expressible. If you're the parent of a child with apraxia of speech, or you think your child might have apraxia, you probably have some questions. Are they just a late bloomer? Will they need speech therapy? Will my child ever talk? These are all valid questions. Every child with apraxia is unique, with their own individual strengths and differences. However, one thing we do know is that a child with apraxia is not likely to outgrow it. Speech therapy is needed to help them improve their communication. Let's talk a little bit more about this. As a quick overview, apraxia of speech is a motor planning disorder. The child may know exactly what they want to say, but their brain struggles to tell the muscles in their mouth how to move in order to make the right sounds. As a result, they have difficulty coordinating their mouth to turn sounds into syllables, syllables into words, and words into phrases. People with apraxia are often described as being difficult to understand. It's important to know that speech therapy is necessary to treat a diagnosis of apraxia. It's uncommon for a child with apraxia to catch up on their own. That means there's no benefit to waiting to begin therapy. In speech therapy, the child will learn the correct motor patterns for producing speech. So as you can imagine, the earlier they can begin getting this help, the better. If your child is diagnosed with apraxia of speech, your speech therapist will create a treatment plan that includes specific sound-related goals. Therapy will focus on frequent practice and repetition of these speech sounds. Having at least 3 sessions a week is often recommended. Speech therapists use different techniques to help children learn to produce sounds and words more clearly. For instance, they may visually show the child how to make each sound with their mouth. They may use tactile cues, such as touching the lips to remind the child to close their lips for the sound. The speech therapist may also produce speech sounds and have the child say which are correct or incorrect. Your speech therapist will monitor and track your child's progress towards each goal. For the best outcomes, speech therapy may be needed for several years. So if you suspect your child may have apraxia, don't wait to schedule a speech evaluation. The sooner therapy begins, the sooner your child will start making progress.